Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I am happy to welcome Dr. Joseph Cleaver, a true advocate of integrative medicine and its preventative focus. As co-founder of Paradigm Wellness Medical Group, Dr. Cleaver considers hormonal and integrative therapies and functional medicine to be critical and effective in combating the signs of aging and chronic disease. Well, thank you so much, Dr. Cleaver, for joining us today. I know you've got quite the hectic schedule, so I appreciate you taking some time out of your day.
It's my pleasure.
Well, thank you. So let's go back to the beginning of your journey, and if you'll tell us a little bit about your interest in medicine and how that got started, and if you were a science geek growing up or what have you.
Oh, I was definitely a science geek. As a matter of fact, I'm half Italian, and when I was 12 years old, I actually started making wine. And that was in my blood, but the chemistry and all the geekiness was there. And I made wine throughout, into my teens.
You must have been a very popular kid in high school.
Yeah, we'll leave it at that. I don't know how good my wine was, so I don't know how popular I was. But it was just a fun hobby as growing up. And then I kind of lost track of it, and then ended up in really science-oriented high school, college, and then eventually went to medical school. And being Italian, I was actually educated in the Mediterranean. So I received my degree at the University of Rome, Italy. It was probably one of the best moves I ever made, and the education is just first class, top-notch professors. I mean, the universities have been there for 1,000 years. And when I returned to the States, I integrated back into the American system with very little trouble. I really didn't have to study for my licensing exams or my board exams. And
you did your residency and fellowship back in the States?
Yeah, so when I graduated medical school and received my medical degree, I did my residency at Robert Wood Johnson in New Jersey in internal medicine, and my fellowship at Jackson Memorial University of Miami in rheumatology. Subsequent to that, I actually I moved to Dallas and was a professor at UT Southwestern for a couple of years. And people always ask, when you're interviewing or patients or other docs, how did you get into integrative medicine? And it turns out that I think it was always inherently the passion was there, in me, from the start when I started pursuing science and medicine. And a lot of docs I see will talk about how they had a life-changing event, some illness, or actually conventional medicine failed them. None of that happened to me. I'm so blessed to be able to be a board-certified internist and integrate that into functional medicine and the availability of other options and therapies for our patients to improve their quality of life, either prevent illness or treat illness and give them options.
Do you give credit to the education that you had at the University of Rome with perhaps setting the stage for using integrative therapies?
That's a good question, and it's absolutely true, because being immersed in a culture such as the Italian culture or in the Mediterranean basin, the education was, there was a large component of functional medicine in my medical school. The impact of nutrition. There was almost a PhD in nutrition.
So you didn't
integrated.
get the typical 1 hour in medical school?
No, not at all.
Okay.
You would have all my exams were oral in Italian, so it wasn't it wasn't a simple task graduating by any means. And I'm fluent in Italian, and but during an exam, a medicine exam, your professor would ask you the influence of certain nutritional components on heart disease or prevention of heart disease. So I think that seed was planted probably certainly in medical school in the Mediterranean basin.
So you come back and you do your post-training here in the States. So did you have any frustrations in terms of the approaches that you would take because it was a little bit different than how you were taught in Rome?
No, not at all. What had actually happened was I quickly gravitated to the Cooper Aerobic Center, which is, at the time, I was there in the late 90s. I was there about 15 years. So I've been in practice 20 plus years. And the Cooper Aerobic Center was one of the premier preventive lifestyle medicine clinics in the country, if not the world. And
how did you come to work at Cooper?
I think being in Dallas, Texas, the influence that the Cooper Aerobic Center, Cooper Institute had on the Metroplex and in medicine, it was everybody just knew that the clinic was there and the aerobic center was there. And how I got hired was I was always been physically fit, taking care of my health, eat well, et cetera, et cetera. We wear our message. That's one of our mantras, or one of our taglines in our practice. So I went over to the clinic as a patient, and they do treadmill stress testing, nutritional testing. We talk about sleep, et cetera. And by the end of the day, they hired me. So spent about 15 years at the...
Were you working in research there, or what were you doing?
Initially, it was patient care and countless treadmills, nutritional counseling, lifestyle medicine, prevention. So it falls under the umbrella of integrative medicine. And it's the purest form, I believe, of real medicine is prevention and lifestyle. And I gravitated over I started doing a lot of research when eventually landed in the Cooper Institute for about the last 3 years of my time there, and then went into private practice.
So how did you come to open up Paradigm?
Yes. So I took all the knowledge that was developing over the years at Cooper, which was very early. I was balancing hormones. I started as a rheumatologist. I really just turned that towards sports medicine, because your patients are very active, they live very healthy lifestyles, and they get injuries. So as I started building my medical career and services and my expertise, it was really out of necessity of my patients. And not to diminish it, but it turned out to be very convenient and almost one-stop shopping for your patient. You can take care of your patient, and from a preventive perspective, they get out and become very active, and they start running marathons, and they get injuries, and now you have to answer that question for them. So you start bringing in regenerative medicine to address those issues. Then they're feeling great and they want to live a long time. They look in the mirror and they go, I feel great. Who's that old person in the mirror? So I integrated or started aesthetics years ago.
So how did you come to find A4M? And did you, at that point, do your fellowship?
Yeah, so what happened was that type of medicine, that model really didn't exist. And when I opened up my practice, I left Cooper in 2008. That was about 10 years ago. And right around then, I was, you're online, you're up till 3 a.m. trying to search something that you can't find in the conventional setting, if you will. But once you start off on that trek of integrative medicine, functional medicine, et cetera, it's a passion. And so one night I remember stumbling upon the A4M website. And that was 10 years ago, I think, and I signed up for a hormone symposium. Pam Smith taught it, and I think at the time the A4M maybe had a total of maybe 5 certifications. There weren't many, and I think compared to today, so a great success for A4M. And I started out becoming certified in hormone optimization, and stayed with A4M and eventually started speaking here. I'm really ahead of the curve with regards to regenerative medicine now, because I brought that into my practice out of necessity, as I mentioned, and really refined my regenerative medicine practice. And when we look under the umbrella of integrative medicine, we see regenerative medicine there, and the application is aesthetics. The application is sports medicine, orthobiologics, joint injury, joint preservation, et cetera. So my practice is really morphed into more of an aesthetics practice, to cater to my patients. And the wonderful possibilities we have thinking outside the box, taking the blinders off and saying, how else can I help my patients? And we look at our job, in my opinion, is to find the safest therapies with the most effective outcomes to keep your patient really, improve their longevity, their quality of life, and happiness. And so currently in Dallas, aesthetics has always been very popular, and it's even more popular than ever before. So my practice is gravitated a little bit more towards regenerative aesthetics. And
so you're utilizing what type of protocols?
Yeah, so the ability to move into the regenerative space and say, oh, I can use biologics. I've been administering or using PRP, for example, in my practice for 10 years. And that has moved into other biologics and then into using PRP for aesthetics. Now I'm adding peptides. Peptides are going to be a game changer. They're going to influence the way we practice medicine conventionally or in functional medicine, integrative medicine going forward. So I started creating protocols that combine PRP and peptides and regenerative medicine is wonderful because I can look at hair restoration, I can do facelifts, orthobiologics, we can inject joints, tendons, ligaments, even sexual health. So the regenerative medicine aspect of my practice is just it's wonderful. I mean, the passion. I have such passion for being able to find the cutting edge tools in regenerative medicine and bring them to my patients in a safe manner.
And who is your typical patient?
I think it's changed over the years. The internet is a double-edged sword. Your patients go out there and find all these horrible things that may happen to them with therapies, and you have to, reel that back in and manage it and show them the positives of what you're doing. And there's very little downside to my therapeutic approaches anyway. So a typical patient years ago, when I first started in medicine, my patients were probably in their 50s, and it was lifestyle medicine, and then hormone balancing, then aesthetics, etc. And that age has dropped, to my average patient is probably 35 to 40 now. My new patients, I have a lot of millennials in my practice, and that's due to the internet. And that was the point I was trying to make, actually, because as the patient population, our society, our good consumers go out on the internet and educate themselves, they see the options that are out there, and it makes a lot of sense to them. And that's what's driving really where integrative medicine in the future is going to end up. There's certainly challenges that in integrative medicine, anti-aging, regenerative space, whatever you'd like to name it, we think outside the box. We're thought leaders, and when we do that, we're gonna have challenges. So the end result is the consumer, the patient, seeks us out because they're really not satisfied with the current state of medicine in this country, unfortunately.
So can you discuss how important being educated is for the practitioner?
I'll give you a great example. When you tell them your background and your education and what your options are to move from a conventional space or conventional medicine into more integrative practice, you tell them the options. I said, this is where I started 10 years ago in A4M. It's, in my opinion, the premier educational institution that physicians need to seek out to really obtain the best education, best qualified, and best trained. The second part of the answer was, physicians actually will ask me, how do I do this? How do I get there? How did you get there? And that's what I tell them. I mean, I tell them you can look around and don't take a weekend course. You have to find the best educators, the best certifications that will prepare you to have a successful practice outside of conventional medicine. integrative medicine, taking conventional medicine and moving into a different space with, with the understanding that you know there's something else out there you can offer your patients that will improve your quality of care. That's the most important driver, in my opinion, to move from conventional medicine into a more integrative medicine space.
So at what point did you decide you want to, and why did you open up a wellness center out in Napa?
As I mentioned, as Italian winemaker as a kid growing up, that was always another passion of mine. And being able to use all that organic chemistry, actually, we probably don't use in medicine, you can use in winemaking. So I purchased the property in 2007, and right away I put in vineyard, olives, just a quintessential Mediterranean wine country estate, what you would expect. It was always a dream, it was just a wonderful lifestyle and have the being fortunate enough to find the right property and to embrace wine country. After becoming established in wine country, bonding a winery, I decided to open up a practice in California, in Napa Valley. And the reason,
nothing wrong with that.
Yeah, the reason why is I do wellness programs for my patient population, and the property, the estate serves has a dual purpose. It's a winery, but it's also a destination for wellness and healing.
So what type of therapies do you do there?
We really start out with the most important thing is when you create a very personalized wellness program for your patients. And my practice by design is I'm low volume, very personalized. So my patients are all friends. They all have my cell phone number. They can call me anytime. So when they come out to the property, their most important thing is I have to get them out of that toxic environment. And as soon as I do that and give them some good energy and some good sleep, they start healing. Then we can get into a fine-tuning the most important cornerstones of a healthy lifestyle. Restorative sleep, as I mentioned, balanced nutrition, a certain amount of exercise that has an impact on your health, your metabolic health, and your longevity, and stress management. Stress management is the most important aspect, I think, of lifestyle, and probably the most difficult to tame. The property has 2.5 acres of vines, and I make an estate red, 2 estate reds actually, a rosé, and then we make a Cabernet and a Chardonnay from Napa.
And what is your label?
It's called Locanda Wines. And Locanda in Italian is a special romantic destination. So that's where the name came from.
What therapies and protocols do you integrate into your own life?
Therapies and protocols. Oh, interesting. It starts with lifestyle. Anytime I do an interview, anytime I talk to a patient, I said, we can try and balance your hormones. We'll balance your hormones. We're going to control your stress and adrenal support and all the things we hear about in integrative medicine. But we're going to start with lifestyle. And as I mentioned before, that's one of our taglines. We wear our message. So adequate sleep, exercise, nutrition, stress management.
Okay, let's start with the first one. How much is an adequate night's sleep for you?
If we look at all 4 of those cornerstones and we look at the impact it has on longevity and something called telomeres. Telomeres we know are basically the clocks, if you will, longevity clocks in our cells. And the shorter our telomeres, the shorter or the quicker we're actually going to come to our demise. So we have, on average, we look at the literature, 7 to 9 hours of sleep. On average, patients have longer telomeres. So their longevity is probably improved, at least by biological age. So less than that or more than that, that patient population has a shorter telomere length.
Nutrition.
Nutrition. As I mentioned, I lived in the Mediterranean basin. I was educated in the Mediterranean basin. So my nutritional approach is always a Mediterranean diet. It's the most studied lifestyle in the world. It has there's more research showing that the Mediterranean lifestyle and diet has the lowest cancer rate, lowest heart disease rate, and longest longevity in the world. So it's a very plant-based diet, but it's very enjoyable diet, meaning people go, oh, vegetarian and vegan, I can't do that. That plant-based diet, I can't do that. You can't say that in America. But when you look at the fundamental low inflammatory, high in antioxidant, nutritional base of the Mediterranean diet, it is mostly plant-based.
So are you on a Mediterranean diet?
Absolutely.
So gluten, no gluten? Being of Italian descent, it's got to be a little tough.
Well, so that's the misconception of the Mediterranean diet, and the Italians themselves. Knowing this, actually, when I lived in Rome, I was a poor student, so I had to do a lot of different jobs, and one of them was I cooked in a lot of restaurants. So I really embraced the Mediterranean diet. That plus cooking it, plus all the nutritional courses that I had at my medical school, I understood the Mediterranean diet, the fundamental, authentic Mediterranean diet, not an hijacked, if you will, Mediterranean diet, where we eat a lot of American macaroni and cream and butter. That's not the Mediterranean diet. When I describe it to my patients, think of a poor farmer with a garden in his backyard, and that's what he has to eat every day. So you eat fresh, eat local, eat organic. There's going to be some luxuries. You will have some meat, some dairy. Eggs are allowed, some sweets. That's a real treat. So for the majority of what you eat in the Mediterranean diet is what you grow locally.
All right, you said adequate sleep, nutrition, and what was it, lifestyle? Or was that part of it?
So the four cornerstones,
Okay.
We talked about sleep, we talked about the Mediterranean diet, and it's linked to the longer telomeres, by the way, omega-3 fatty acids, olive oil, all those components of the Mediterranean diet lengthen telomeres, lengthen longevity, improve longevity, I should say. Stress management. Stress management is, as I mentioned, it's the toughest, it's the most difficult risk factor to change in somebody's lifestyle. We're all under stress 24/7. The wolf is always at the door. We're not designed for that. We're designed for let the wolf chase me for an hour, and then I survive and I can get away from the wolf. So the imbalances that it causes in our systems in our body have the biggest impact on longevity or shortening our lifespan than the other three cornerstones. So everyone's a little bit different in how they address stress. My job is to help that patient, guide them into where or which, how they're going to change their lifestyle, how they're going to manage stress. We can't get rid of it, as I mentioned. We can't eliminate it, but and we can change it sometimes. We can reduce it. It's never going to go away, so we have to manage it better.
So how do you recommend people do that?
We go through the list of things that can improve stress levels in patients. For me, when I go to the gym and I lift weights. That's just me. So you have to find out what's best for you. I can't do yoga. Some patients love yoga. Many studies show it decreases cortisol levels, improves telomere length. When we reduce stress, we lengthen our telomeres more than changing the other lifestyle parameters that we talked about. If we look at, for example, caregivers are always forgotten, by the way, and they're under enormous amount of stress taking care of a loved one. And when you looked at patient populations, caregivers have shortest telomeres. So there's resistance training. That's for me. Some people need to run marathons, yoga, Tai Chi, meditation.
Where does the wine fit in? That would be my preference.
Well, I think you can do yoga with a glass of wine. We should start a new yoga
not necessarily standing
trend.
on my head, but right. Okay.
Yeah. A glass of wine in a Mediterranean diet is balanced and healthy, in my opinion.
Wonderful. So what would you say you're most excited about the new protocols that are out there?
In my practice,
Overall.
in integrative medicine,
Yes.
The wonderful aspect of integrative medicine is we are always seeking new therapies. We're always seeking new science, and peptides right now are on the forefront. and the ability of peptides to be able to target disease, target prevention, target aging, and the versatility of peptides, I just think that is going to be we're going to be riding that wave of therapy for quite a long time.
And minimal risk to the patient.
Peptides are very safe. They are natural. We have thousands of peptides already in our body that are signaling proteins. They tell our body how to function. And when we start to age, if we prematurely age, and we're not doing all the good things we talked about regarding lifestyle, we want to start with lifestyle and then see where a peptide can enhance our lifestyle approach to longevity and health. So peptides can help, I believe, balance those systems that, in addition to what we're already doing with regards to lifestyle. The rebirth of peptides in integrative medicine and in aesthetics is very exciting because we have more than just copper peptides. When we look at mechanisms, how peptides work to rejuvenate skin, regenerate hair and hair follicles, the addition of peptides to regenerative aesthetics is very exciting. So currently I'm taking my protocols that I use for rejuvenation, skin rejuvenation and hair restoration, for example. I use PRP, which is very common now in a lot of practices, and I'm adding peptides to that protocol. Because if you look at the mechanisms of action between some of the peptides and PRP, there's a synergy that will stimulate stem cells and in a healthy manner, stimulate collagen and create healthy new skin and move a hair follicle, for example, from a rest phase back into a growth phase, an anagen phase.
All in a non-invasive way.
All
no downtime.
It is non-surgical, minimally invasive. So my protocols are always focused on minimal downtime, minimal side effects, and the least discomfort. In the regenerative aesthetic space, there is a void between the availability, if you will, of neuromodulators and the commercial fillers, and the option of seeing a plastic surgeon. My colleagues are dear friends of mine that are plastic surgeons and dermatologists in Dallas. I refer to them a lot and they refer to me. The void and the role I play is between those two, in my opinion, where I can offer my patient a regenerative aesthetics program that is all-encompassing to do or to create a very safe and quick recovery, non-invasive facelift. And I'll draw on PRP and peptides for skin rejuvenation. We'll use the commercial fillers for volumization. And then we move into lifting with products such as PDO threads. And you combine those three, and it's a wonderful option for your patient who does not want to necessarily go to have a invasive plastic surgical procedure. It's not to say that at some point in time they will need it, if you will, in their mind or their eyes, and that's fine. But it's wonderful to offer them other options that fill, in my opinion, this void in regenerative aesthetics, or in aesthetics that is really regenerative aesthetics that we do.
What's the longevity of this type of procedure?
And that's a very common question. And if we look at the neuromodulators, they will last, as most people know, maybe 3 months. If we look at various commercial filler products, depending on the density of them, for lack of a better description, they will last anywhere from 12 months up to 24, 36 months. When we create a multidisciplinary approach where we lift, volumize, and skin rejuvenate, we can last 2 to 3 years.
Wow. And what's the cost difference between that protocol, mm-hmm. not compared to plastic surgery, but that protocol compared to getting the Botox, Restylane, fillers, et cetera?
Well, the protocols will integrate the Botox and fillers.
Okay.
But a Botox or a neuromodulator and a filler can only take you so far. And I employ microneedling, mesotherapy in my practice. I don't do laser. I just think that I can get as good or better results with with microneedling or mesotherapy, with the biologics, the peptides that I'm using now, with wonderful collagen induction, wonderful skin rejuvenation and skin tightening. We're looking at doing 3 procedures that if we do a facelift, it would be with threads, with fillers, and neuromodulators, and mesotherapy. It's around $5,000.
For a good few years worth of, right, that's great.
The trend I've seen in integrative medicine space, anti-aging, bioidentical hormones, whatever title or name we want to use, is the sustainability of that practice. And more docs are gravitating to embracing aesthetic services, aesthetics procedures in their practice. And I think it's a win-win, because your patient will see you, they trust you, you have a great relationship with them, you're balancing their hormones, their lifestyle or their quality of life is improving, and you have a patient that is probably going elsewhere for their aesthetics. So to incorporate aesthetics into your practice it makes all the sense in the world to me. And I've been fortunate to have both of those modalities in my practice for a lot of years. As I mentioned before, just out of necessity, I saw the need for aesthetics years ago in my practice when I started adding bioidenticals, for example. So the models today and the integrative medicine leaders at ABAARM see that aesthetics medicine or aesthetics procedures are extremely important in this space. So more and more docs, more and more physicians are embracing the aesthetics training at ABAARM. And the training, I think, the quality of training is imperative in a successful practice.
Thank you so much, Dr. Cleaver. I appreciate your time.
My pleasure.
And best of luck to you.
I enjoyed it. Thank you.
Thank you.